Evening, everyone.
It's good. I got that letter this morning.
Can we start off with an introduction from our interpreter, please?
Yes, thank you. Good afternoon, everybody. I'm here with the Community Language Cooperative. We're going to be practicing language justice today, and we're going to provide simultaneous interpretation in English and in Spanish so that everybody can hear and speak in the language of their heart. Once we turn on the interpretation, if you're on Zoom, you're going to see a globe that is going to come up at the bottom of your screen. You're going to click it and you're going to select your preferred language. If you're fully bilingual, you don't have to select the language and you can hear and speak in whichever of those you feel more comfortable. Please remember to speak at a conversational pace. For those that are going to be presenting today, remember Spanish takes longer than English, so it will take me longer to say everything that you're saying into Spanish. And please speak very close to your microphone. Hola a todos, estoy aquí con la Community Language Cooperative. Hoy vamos a estar practicando la justicia del lenguaje. Tendremos interpretación simultánea en inglés y en español para que todos podamos hablar y escuchar en el idioma de nuestro corazón. Una vez que aprendamos la interpretación, si estás en Zoom, vas a ver un globo, un círculo en la parte inferior de tu pantalla, donde vas a poder seleccionar tu idioma. Recuerda hablar un paso conversacional y mantenerte mudo cuando no estés hablando. And we can begin interpretation now.
Thank you. All right, our first item tonight is a presentation from Arapahoe County Public Health. Welcome. Good to see you.
Welcome back.
Thank you so much. Well, it's good to be back. I was here last year at some point, I think it was in the last quarter of the year, to present on our progress. And it's great to be here this year. We are now a year and almost a half into our new health department. Lots of progress. Tonight, we are specifically here to get your thoughts and ideas around our community health assessment. There are 3 of us presenting tonight. I'm Jennifer Ludwig. I'm the Public Health Director for Arapahoe County. And I have Heather Baumgardner is the Director of Planning, Partnerships, Planning, and Community Health Promotion. And Alexa Escobar Paez is our Senior Population Health Epidemiologist. The 3 of us will be presenting different parts. And then depending on how much time we have, we'd love to hear from you and your thoughts about the information that we're sharing with you. Next slide, please. So quickly, just a real quick update on our status and our progress. And then we have entered into what is a really important aspect of our work, and that is the community health assessment. And we'll be providing you with some information about that assessment and the top 6 issues that came out of that assessment. And then we'd love to get your reflections for alignment and opportunities. And then we'll talk a little bit about next steps. Next slide. But before I dig into that, I do want to just a couple acknowledgements. First, I want to thank you and appreciate the language justice that you follow and the simultaneous interpretation. I think that's really important, and I wish we were there. And it gives me inspiration to do that for ourselves as public health. And then I also want to thank you for your support in the past as we were getting going, and then currently as we've been working with you all with Love My Air and the recent partnership with the Arapahoe Libraries. I'm really excited to get that kicked off with air quality monitoring. So I'm looking forward to that kickoff and doing more with you all and the libraries. So thank you so much for your support. And our mission or our purpose is to protect and promote equity, health, and well-being of our community through evidence-based interventions, education, advocacy, and policy development. And our work within that has started, but we're really gearing up to take it to the next level. Next slide. So just a couple of really quick highlights. I think it's important, and it's important for me as the director to acknowledge how all the hard work last year of starting a new health department, tons of operational and procedural work was done at the same time we were delivering services. So we started last year with 182 approved staff, the FTE. We started with 160 plus 40 contract, but we are now up to over 200 employees and 198 approved FTE to really meet the needs of the community. And we still have a lot of areas in which we need to grow. But I'm really proud of the work that the team has done. Last year, we spent a lot of time and focus on workforce development, transparency, and engagement. We created what we call the Public Health Ambassador Program, that all public health employees are ambassadors in the community, listening and hearing and understanding what community wants and needs are, and bringing that back to us so that we can really decide and make strategic decisions on what and where we allocate resources. And they have been great spokespersons for our agency. And then also wanting to be more visible, transparent, and communicative with our elected officials. So we've been doing a lot more updates
Okay.
for city councils and really engaging city councils more, and really appreciate the time that you have given us twice now. Next slide. So these are just a handful of numbers that represent our service numbers across the county at all of our locations, not necessarily just in the Sheridan area. But while I said we were doing a lot of operational, we were also serving the community. And I'm really proud to say, with the staff that we had, what we were building and what we were looking at, we were able to meet all the needs of our community and continue to grow. Like our WIC program, in which they saw over 67,000 visits. Our WIC program grew by 1,500 clients since last January. So there's great need, and we've been able to meet that need. Next slide. So now I'm going to turn it over to Heather to really introduce the main reason why we are here tonight and really where we are in our next phase as a health department. So thank you.
Thanks so much for your time this evening. Just briefly, we wanted to give a little bit of background around our process, and this is something that's laid out for us in state statute. And it will probably sound very familiar. I'm sure you're familiar with schools and other entities who do kind of similar processes, maybe on a different scope or scale. But every 5 years or sooner, at both the state and local level, health departments in Colorado need to do a comprehensive community health assessment, really casting a very wide net, looking wide breadth, also deeply at the health issues, looking at the trends. So we're looking at a lot of health burden data, but also, as Jennifer mentioned, listening to the community, finding out what the desires, needs, assets are looking like, so that as we're using limited resources that we do have and the time of our partners, that we're coming together to identify top priorities where we feel like we can have the most traction, make the biggest impact in the next couple of years. And so, as Jennifer mentioned, we have many programs and services that we will continue to offer, but this is an opportunity for us to connect more deeply, really reflect those needs, and double down to really get some traction in a couple of very top areas. So next slide. I think I've actually covered each of these. So we started this process in January. We did quite a bit of planning, community listening sessions everywhere we went, really trying to understand what folks were thinking and desiring, did surveys within the community, and we are now at the process. We've completed our health assessment, so I'm going to give a copy to each of you. It's also available online, and we are right now in the middle of assessing capacity related to identifying the top 6 issues that emerged from the assessment. And part of that is our desire to speak with you this evening about some issues that would impact capacity and give us some additional information to inform that prioritization process. That will occur with partners, and we'll come to a top probably 2 or 3 issues we're hoping around June. And then the plan itself will be developed in the summer and fall. And the final community health improvement plan should be complete around October, November timeframe. And throughout that process, we want to just have a lot of transparency and engagement, working together on the issues. So I'm going to turn it over to Alexa Escobar-Paez, our senior community health epidemiologist, who did an enormous amount of project management and technical work on this report too.
Thank you, Heather. Hi, good evening. My name is Alexa Escobar Baez, and I'm the Senior Population Health Epidemiologist at Arapahoe County. And I am grateful for your time today to share a little bit about our findings, some of our findings for our community health assessment. So if you could just, I think, to next slide. Okay, so as mentioned, this assessment aimed to capture the landscape of the various communities in Arapahoe County and their health. To do that, we gather, analyze, and report on data. We also use a combination of primary and secondary data sources as well as quantitative and qualitative data. So at the beginning of this process, we knew that it was very important that we hear from a variety of community members and leaders. And an example of how we did that was using the CDC Social Vulnerability Index. And what this tool does is that it looks at various social determinants of health, such as income, access to reliable transportation, and so on. And then it assigns a census tract a score that is meant to designate the level of vulnerability people living in that census tract have to poor health outcomes. Next slide. We also made deliberate efforts to capture information, capture the thoughts, the feelings, the things that are important to people that are currently being affected by current public health concerns, and also from communities that have been historically underrepresented. So our survey was open from July to December of 2023, and we had a little over 1,000 survey submissions. The majority of those submissions were from community members, but we did also hear from partners, county staff, and leaders. We were really happy with how our survey response turned out. Next slide, please. As we analyzed the data, the following high priority list emerged. So these are not in any particular order. We have safety, which included aspects such as gun violence, suicide, homicide, injury prevention, neighborhood safety, interpersonal violence, and motor vehicle safety. Housing issues included factors such as access, affordability, safety, and homelessness. Similar to housing, food issues included cost, accessibility, and availability. Environmental issues also came up, and this included clean air, clean water, green spaces, and climate change. Economic security concerns revolved around financial well-being, navigating assistance programs, and the impact of financial stability on mental health. And then lastly, access to physical and behavioral care. Concerns around this area were about the ability to find a provider, the ability to pay for services, insurance coverage, care for newcomers, and care navigation, and more. So today we're going to dive a little bit about on each of these topics. Next slide, please. The relationship between income and health status is well established, with higher incomes often leading to better health outcomes. In 2022, nearly 4 out of 10 people in Arapahoe County making less than $25,000 a year reported very good or excellent health, which is great. However, 7 out of 10 people making more than $75,000 a year reported excellent or very good health. So we are seeing that relationship of, more income can often lead to better health outcomes. We also see this relationship when it comes to mental health. So 1 out of 5 Arapahoe County residents making less than $25,000 a year reported having poor mental health. Next slide, please. For most of us, our incomes have a direct relationship with our housing, and data shows that wages are not keeping up with housing cost. According to the Housing Standard Act, it is not recommended that a household spend more than 30% of its income on housing so that you have enough money left over for other expenses. Households spending more than 30% of their income on housing are considered cost burdened and tend to have to reduce other necessities to be able to make ends meet, such as food, childcare, internet, transportation, and the ability to have a savings account, which we know is very important. In 2022, 62% of renters in Sheridan and nearly 2 out of 5 homeowners were paying over 30% or more on housing, so they were cost burdened. You can see on the graph that renters tend to more often pay more than 30% on their housings, their homeowners. And so you would think, well, maybe a solution to that is just enter the housing market, buy a home. However, when it comes to entering the housing market, financial obstacles are much larger now than they were a few years ago. In 2023, the national sales price for a starter home was up more than 45% nationally before the pandemic. And in Arapahoe County, the median home sale price for January 2024 was up by 24% compared to 2021. So the rising cost of owning a home and the continuous hikes of rents make it harder for people to avoid homelessness. And it can also complicate things for people that are trying to come back from homelessness. We see that in Arapahoe County in 2023, the number of people experiencing homelessness doubled since 2022, and a little over half of those people were experiencing unsheltered homelessness, which means that they were living on the streets. Next slide. Let's pivot to safety. Safety is a key social determinant of health. And when we asked our community members, our staff, our leaders, they said that safety from violence, discrimination, crime, and disease is incredibly important for well-being and overall health. In Colorado, firearms are the leading causes of death associated with suicide, community violence, domestic violence, and targeted mass shootings. In Arapahoe County, between 2000 to 2022, there were 37 firearm-related homicides for youth aged 1 to 17. And on the screen, you can see a map of where these deaths occurred and the concentration of them. And according to the recent Healthy Kids Colorado data, tells us that 1 in 6 students reported missing school at least once in the previous month because of feelings of unsafety. Together, these statistics invite us to discuss the topic of safety around our younger populations, both in and out of school environments. Next slide. Let's pivot to access to care. Easy access to reliable, affordable, and culturally appropriate care is a fundamental right, and it is the best way for us to mitigate the effects of illness and also to maintain good health. All right, I'm gonna read this because I don't want to get this slide wrong. So on this slide, you're gonna see a graph of the state of Health First Colorado enrollment and renewal with the public health emergency unwinding in the backdrop. So the bottom bars are showing us Colorado's pre-pandemic average disenrollment rate, which closely aligns with the current Colorado public health emergency unwinding average. So 44%, 41% are not largely different, which is a positive. However, the Colorado Department of Healthcare Policy and Finance is not satisfied with pre-pandemic norms, and is implementing more and encouraging more short-term and long-term solutions to improve overall eligibility processes. Now, if we want to look deeper into these denials, the middle bars are showing us eligibility denials, and these typically tend to be for income. And we can see that currently the denial rates for, eligibility reasons are lower than they have been historically, which is a positive. The top bars indicates the procedural reasons for denials. So these include such as things as filling out the paperwork, filling them out on time, making sure that people are easy to reach so that they are not lost in the system. And we see that this is doubled in the historic levels. Now, although this is not surprising either, reducing inappropriate procedural denials is a priority. So enhanced member outreach, improve automatic renewals, shortened renewal packets, and so on are examples of strategies aimed to reduce inappropriate procedural denials. Next slide. One of the many critical roles that public health plays in protecting community is through immunizations. Immunizations are highly effective and are supported by robust medical and scientific research. In 2022, 86.8% of kindergartners were vaccinated against measles, mumps, and rubella, so the MMR vaccine. And this is the lowest vaccination rate since 2017. In Sheridan, for the same year, 2022, 93.2% of kindergartners were vaccinated with an MMR vaccine, which is very positive. When we look at the data for K through 12, however, we do see that the polio and the Tdap vaccines have the lowest vaccine completion rates. Now, some potential reasons for decreased vaccination rate include difficulty maintaining records, limited access to primary care services, lack of insurance, limited knowledge, and the spread of dis or misinformation. Next slide. Okay, let's talk about some open spaces. So the well-being of Arapahoe County residents depends on a ton of things. However, access to safe and easy reachable outdoor spaces came up as one of the priorities, not only in our environmental scan, but also in our survey. So since 2014, about 13,000 acres of open space have been added to the county, which is excellent. And it's also an incredibly good strategy to help, combat depression and anxiety, since these symptoms seem to be more relevant in areas that have lesser access to green spaces. Next slide. And now we can wrap up this portion of the presentation with some food. So nutritious food is vital to our survival, but for many of us, it's also how we connect with the people that we love and how we care for those around us. And that is why programs such as SNAP and WIC are fundamental services to many of our Arapahoe County residents. In 2022, SNAP assistance to the county totaled $14.4 million. And in 2023, the number of WIC participants exceeded the 2019 average, reversing a downward trend that we saw in 2022. In Sheridan, WIC purchases in grocery stores totaled approximately $61,000. And that concludes the data portion of this presentation. Thank you so much.
Thank you.
As you can imagine, that was a bit of a speed round snapshot of the wealth of data that's in the report. We have about 150 different data visualizations that you'll find there. And we wanted to say if there are areas you'd like to explore further and we'd like us to dig into, see if we can find even more localized data, please don't hesitate to reach out. We would love to partner with you on that. So before we transition to just a couple of discussion questions, I'd like to start off with a quick word of thanks. We consider municipal leaders like yourselves to be among our most important partners in creating conditions that support health and well-being. And we wanted to share our sincere appreciation for your individual and collective efforts impacting each of these areas, as well as the great work of Sheridan Rising Together for Equity, the Can Do Group, and the Tri-Cities Initiative. We know there's so much going on, and we appreciate your time working on that and talking through these with us to inform what we might be able to do together moving forward. So just a couple of questions. We'd love to get your reaction. Do the topics that you see, the top 6 that we saw emerging from our information, safety, housing, food, environment, economic security, and access to care, are they aligning with what you are hearing from constituents most recently and most urgently? I see one yes. Are there any nuances that you would add to any of these topics? We know there's a lot of ways to define each of these categories and a lot of different strategies that could be brought to bear to address them. I don't know if when you think of what you've been hearing from constituents, if any specific elements of safety, for example, stand out, or food access, any of the categories.
I would say that, things that we have heard before, I don't know, I haven't really talked with people super recently about some of these topics, but we always hear about affordable housing. I mean, that's top of mind, I think. And as you saw in your statistics, it's not really affordable for most people in the city, the majority of people in the city. So, and then I think we always hear that people like our parks and trails. So I think hopefully we're doing a pretty good job on the open space part of it. So I would say that's one where maybe we don't have as much of a deficit, as opposed to like food, you know, we generally get the feedback that stores that are affordable, you know, regular grocery stores can be quite a distance away for people here.
In looking at the list and thinking about potential strategies, I'm curious to know, are there any areas where you feel the city has particular interest in partnering around, or, you know, more momentum and traction than possibly some other areas? Any efforts you're particularly excited about where you feel like, you know, this is where we can see ourselves heading in the next 5 years, and we would really love to have public health digging in it as part of that effort.
Well, I know it was super helpful to us, you know, when we had a Sheridan health assessment done. Was that 10 years ago now? It's been a long time now. But I think that proved to be very helpful for us as far as being able to use that data for grants. And so when I'm thinking about affordable housing and, you know, projects that might come up in the future, I think it's useful for us to kind of have that feedback from you all, kind of your input on our community, to be able to include when we go and, you know, try to apply for funds for things like affordable housing or homelessness.
Great point. Yeah, please keep us in mind in circumstances like that. We can often provide data or letters of support or
Right.
commit partnership around some aspects of the work possibly.
And I think, you know, continuing to be partners on the Tri-Cities Homeless Policy Group, which is also going to expand its role more into affordable housing. We're expanding into the most affordable housing, you know, the 0 to 30% AMI, like permanent supportive housing area. So, you know, if you all can, I know you have people coming to our meetings, but, you know, just stay a good partner in that. I think that's a big one, you know.
Mayor,
Yeah.
if I could add in, one of the things that always catches my eye is safety, of course, with law enforcement. And I see that these topics are for Arapahoe County, correct?
Yes.
It's not Sheridan specific.
Mhm.
I would like to, if we can find out, you know, what are the things that our Sheridan residents would be concerned about with safety, because unfortunately, as we've talked before, because of our small population, yet our high, like shoplifting crimes, things like that, it looks like we have an extremely high crime rate here. Well, we do have one when you go per capita. However, it's not violent crime. And that is one thing that I want to make sure that we continue to get out. That's one of the reasons I started the Sheridan Safe program, because it is extremely safe here compared to some of the other places. In Arapahoe County, unfortunately, shouldn't say unfortunately, but has Aurora in there, which struggles with a lot of violent activity and a lot of homicides. And, you know, that's one of the things I want to make sure that we, for Sheridan, as far as it's concerned, if we start pointing out these top 6 things, that we don't confuse some of our residents, our Sheridan residents, that safety is our top priority. Not saying it's not their top priority, but I'd like to dig down and know more of what they're talking about, because we don't have a lot of violent crime here.
Great point. I'm so glad you brought that up. As we report the findings, that's such a good talking point that needs to be shared. There is a lot of variation across the county, and the work and the strategies that get developed definitely can and should be customized so that they're reflective of the different municipalities, definitely.
Thank you.
This question
I
came.
have other
Oh,
questions
please.
that they aren't about the top 6 necessarily. And I was just curious, like, if we wanted to have like an overlay of the data that you had. Do you have that in GIS format? I mean, I don't know if that'd be something that'd be useful to put on our website as a map overlay that we could show some of the data you found out about social vulnerability, you know?
Sure. Yeah. If you want to send us any contact information, whomever you would like to be a point person on that, we can facilitate that data sharing.
Great.
Great idea.
And I think I skipped right to discussion questions. Did you have any questions about the data that Alexa shared by any chance?
How is it looking as far as kind of uptake on SNAP and WIC? Because I know that's always a a struggle to get everyone who's
Right.
qualified to apply and take advantage of it.
And Jennifer can probably speak to this pretty well too.
Well, I know, so we have, we do dual enrollment. Oftentimes it is, they may be enrolled in one and not the other.
Okay.
And if they're eligible for SNAP, they're eligible for WIC.
Mhm.
And while WIC is maybe a smaller financial benefit, the benefit of WIC is the formula, breastfeeding counseling, they're on it until the child turns 5. So there's benefits for both. I know our WIC enrollment has gone up.
Mhm.
I can't speak specifically, I can't to the SNAP numbers, but I do know Human Services is insanely busy with enrolling.
Okay.
And Alexa may know more.
Yeah.
Yeah, I don't have anything to add, but if you would like us to find specific Sheridan WIC numbers, we can definitely do that. We have people who work with that data all the time.
Yeah, I think that would be useful to have.
Helpful,
Then we'd be
yeah.
able to start keeping track of that over time, see if there's anything we can do to increase those numbers.
So enrollment and WIC benefits would be
Mhm.
helpful.
Yeah. And kind of on that same point, can you describe a little bit what that process is? You talked some about I think it was about Medicaid. I forget what the Colorado program was called that you referred it to, but can you talk about like how people get into that and how onerous is it today? I mean,
The enrollment process of Medicaid overall or specific like WIC
in the Colorado,
programs?
in Medicaid.
Medicaid.
Yeah.
It's I think the application, I think, is 98 pages.
It's,
And it's incredibly challenging.
mhm.
And I mean, Human Services, with the ending of the public health emergency and people about to come off of Medicaid, trying to quickly re-enroll, and
Mhm.
not the denials, but how, oftentimes the packet was mailed to the last address that may have been on file. So many
Mhm.
people missed it, may not have opened it. It's challenging to read, and if it's not in your language. So enrollment is incredibly challenging.
Okay. And so what is your role in that? I mean, as opposed to what the state does?
We don't do anything to do with enrollment of Medicaid. We do help people get started. Like we have, they're called peak kiosks where we can help a client get started. And then and we will help get a client to a certain point. If they come in to see us and they're not enrolled, we will refer them, help them get started. And then it goes to Human Services for their review and I don't know. I don't know
Out of
where
your
it goes
hands
from
at
there.
that point.
That would be a question for our Human Services partners.
Okay. So, but there is some work at the county level that goes into that.
Oh,
Sounds
that
like-
is definitely
Okay.
Arapahoe County Human
Mhm.
Services manages that. And then Medicaid is administered by the Healthcare Policy Finance at the state level,
Okay.
State Department.
Are you all directly involved in these changes, like recommending changes to them or no?
When there is opportunity, absolutely. We have what are called the regional accountable, the Colorado Access is ours. And right now there's like moving into a new phase. So we will often find, or if there's opportunity for stakeholder feedback or any opportunity we have for, speaking to improvements or process improvements, we bill for Medicaid for some of our services. So we do work with we call HCPF, Healthcare for Policy and Financing. So we work with them closely in trying to mitigate barriers that we have and that our clients have.
Thanks. That's some helpful context.
Yeah, it's a challenge.
Yeah.
It is a challenging system. Definitely.
Yeah. And the other thing I'm sure that would come out in the survey is that, we do have people who are probably either struggle with, getting Medicaid or can't even apply if they're undocumented,
Or understanding
Yeah.
how to, and then if they make just too much or their income changes, they may
Mm-hmm.
get dropped, but they don't yet have enough, or they may not make enough for the marketplace, or they're in a gap. So
Yeah.
accessing healthcare is a huge challenge
Right.
for a lot of our our people living here, that are newcomers, our residents.
Yeah, I
Absolutely.
think that's an area, where Sheridan Rising's been trying to get out the word of what resources there are, but, if whatever you all can do, I think to help with that as well would be welcome.
Absolutely. I think we have a couple of really good entry points, and that would either be through immunizations, because also our immunization nurses will link to other services.
Mhm.
If they're not on WIC and they're eligible, our immunization nurses will take them down and meet with WIC to get them enrolled. And
see.
then WIC educators will try to get them connected to Medicaid or other services. So
Mhm.
we work closely in public health, and then with all of our other department services or county services, and then other community networks that we are aware of. We work really hard to connect people to services as best we can.
Yeah.
We miss a lot of people, but we do try to connect people to as many things that they could benefit from or are eligible for.
Great. Anybody else have questions or thoughts?
I do.
Please.
So now you've had more than a year, right? Of momentum. What, in your opinion, is better now than when it was Tri-County?
I think being able to focus on a single county, there are many of us who came from Tri-County, so that, just runs deep in our blood. But being proud of being able to carry on a lot of what Tri-County had started or was doing, but also the opportunity to really invest in single county efforts and get to know the community. Tri-County had such a large jurisdiction, serving over 1.5 million people, 26 municipalities. It was a lot, and we didn't have, while we had 400 employees, still wasn't enough for us to be everywhere. So, in my role specifically, I've really been able to get to know community better, understand community needs more, and really think about our resources, how we allocate them, and our initiatives. So I think it's just being able to have that single county focus, even though Arapahoe County is huge, over 650,000, very diverse in the people who live here and who we serve. But it's been a lot of fun. We've got a lot going on, but I think we can just really focus more than we were able to in the past.
Anybody else? No? Okay. Do you have anything else to share, or is that?
The only,
Ed?
so this is the community health assessment. It's also available online. There's tons of information and data and maps in here. So as Heather had mentioned, if there's anything that you would want to dig into a little bit more,
Mhm.
we may have Sheridan specific data, we may not. It just
Okay.
depends on how many people, like we may have a lot of information on opioid overdose, but
Mhm.
maybe not in other areas.
Okay.
So it's very dependent on the number of people and how we can aggregate and share that data. We would be happy though to kind of look at playing with maps. We've been playing around a lot with maps and overlays and how we can depict the information in a very visual way. So if there is something that you see in here that you would like to either understand better or get more information, do let us know. And we've got a great data team, of which Alexa is part, and we're learning and playing with more technology. So happy to look at that. But just really want to thank you. If there's anything that you think of afterward, a group that we should engage with, an initiative that you have in the works that you would like us to know more about, please feel free to reach out to any of us, and we'll follow up with you and learn more and figure out how public health can be your partner and support that effort.
Great. Thank you.
All right.
Thank you for
Thank
bringing the
you.
whole team tonight. It's
Yeah,
nice to
you
to meet
bet.
you all.
Yeah, thank you. Appreciate your time.
Yeah, thank you, guys. Thank you.
Thank you for all you do. Shouldn't let you go without saying that. Okay. Well, we will move on to our next topic, which is a review of what's on our agenda for tonight.
Sorry, Mayor, get situated here. Let me pull up the council packet. So I want to spend a few minutes talking about one of our items. We have two action items on your agenda tonight. One is an emergency ordinance with regards to some FEMA regulations. And then the other one is approval of a contract for the demolition of Carol's Corner Pub in that property. So I think why don't we start with the emergency ordinance and what we are doing there, why we're doing it as an emergency. And when we start with Randy, if you can kind of walk the council through this, Randy, that'd be great.
Good evening, Mayor and council members. So on April 11th, we were notified by the state National Flood Insurance Program Coordinator, Doug Mayhem, that FEMA had approved our ordinance for the firm maps. In doing so, FEMA also did a cursory review of our entire ordinance and found that we did have some deficiencies in our ordinance and that they suspended temporarily our flood insurance program until such time as we got our ordinance back up to speed. Working with Doug Mayhem with the state of Colorado, who was very, very, very helpful to us. We almost did something that is almost unheard of in getting through this process in just a couple of weeks. Helped us go through the state model ordinance, which is what a lot of jurisdictions are going to now and adopting because there are so many regulations surrounding the FEMA ordinances and the flood insurance program. So he helped us through the process. We did adopt or are looking at adopting the state ordinance tonight. And basically, there are some minor revisions that we did have to do to our ordinance to kind of make it for our community. One of those being revising all of the definitions in it to also include mobile homes. As you're aware, we do have quite a few mobile homes in the city. So FEMA did do an audit of us here about 8 months ago and did identify that we do have quite a few mobile homes as well as RVs. RVs are also now classified as a mobile home. So they do have to meet flood insurance policies if they're going to be in floodway. So that's
And
gonna be
Randy,
a-
we do have specific properties that have both of those in the floodplain, right? now.
Yes, correct. So on the staff report, I did give you a list of items that were identified that did have to be incorporated into it. I think it'd probably be easier just answering questions from you on that part of it. If we do approve the emergency ordinance tonight, FEMA has assured us that they will reinstate our program as soon as I notify them and send them a copy of the ordinance tomorrow. So we do have several property owners that are due to redo their insurance with FEMA. And that's one of the main reasons why this is being done as an emergency ordinance tonight. So I think at this time, it's probably easier just to open it up to questions from council.
Is that insurance then carried, like the mobile home parks, is that carried by the owner of the whole park and not the
No.
individuals, or is it each person?
No, it's each person individually.
Okay. So do we know if this will change or include or exclude people who are in those parks in the RV park?
So basically, anybody that's within the flood zone itself is eligible to get flood insurance. So basically, right now, the biggest areas where we have residents and mobile homes in the floodplain would be Ridgeline, Bear Creek, Jefferson, and the 3600 block of Grove to Irving Street. We have quite a few homes over in that one, as well as a couple of mobile homes over in the Bear Valley Village. So we do have quite a few incorporated into this, so.
But
but
this doesn't change who it applies to at all.
No, this does not change
So those
whatsoever.
people would still continue to be eligible, just like they
Yes.
were before.
Yes, correct.
And I don't think we've had anybody said that they haven't, anybody who wanted to obtain flood insurance has not been precluded from doing that in the past. And this
Okay.
won't change that.
Correct, correct.
Any other
Andy, I just had a question. If this does not pass, then that just means that the residents could not obtain flood insurance?
That's correct.
Is there any other?
FEMA has suspended us from the program, so if we do not pass this tonight, they will not be able to get flood insurance.
Thank you.
Any other questions? Okay.
And then Mayor, if it's okay, I asked the city attorney to just briefly talk to council about what an emergency ordinance is. I think we have some folks on council that have not, we haven't been here when we've done an emergency ordinance. We've done maybe a handful in my 10 or so years here. But ask Mary Lynn to kind of go over that process, why we're doing this as an emergency.
Thank you, Devin. So, Mayor and Council, you've heard why we're doing this as an emergency ordinance, but I will cover essentially what the procedure is for passing an emergency ordinance and the justification that's needed, which Randy just covered. So emergency ordinances are covered under Section 4.7 of the city's home rule charter, which expressly gives council the authorization to enact an emergency ordinance under certain circumstances. An emergency ordinance may be passed by council when it is necessary for the immediate preservation of public property, health, welfare, peace, or safety. And as the Public Works Director alluded to, it's necessary to pass this ordinance tonight to ensure that it is in effect before these home insurance and flood insurance policies are set to renew in the next few days and weeks. To pass an emergency ordinance, it does require a 2/3 vote of council. So that means that 5 out of 7 of you must vote yes in order for the ordinance to pass on an emergency basis. These ordinances may be introduced and adopted at the same meeting, and as such, they only require a single reading. So it will be heard, and if council decides to, with 5 votes, at minimum of 5 votes, it will be adopted this evening at the same meeting as it's introduced and effective tonight as well. So that immediate effectiveness will allow us to pass that information on to FEMA to ensure that that the city is no longer suspended from the FIRM program. And then finally, the city clerk has already prepared this ordinance for publication in full, which is also required by your charter. So the city has everything lined up and ready to go for this emergency ordinance, should council choose to approve it this evening. I'm happy to answer any questions about the procedure.
Thank you. Anybody have any questions?
I have one, Mayor.
Yeah.
I was just wondering if, it sounds like this all started off based off of FEMA's reevaluation of, the physical barrier.
I think you need to
Oh,
put your
wait,
mic on.
you turn on
sorry.
your microphone. There you go.
I was just wondering if,
Still can't.
Thank you. I was wondering if, there was anybody that was impacted negatively as far as, not being having that flood coverage available anymore.
Yeah, to the best of our knowledge, nobody has been at this point. We were notified that I believe there were 3 accounts that we're looking at 4. Okay, so we were notified that there are some that are due to renew. By passing this tonight as an emergency, we will be able to accommodate those coverages for those properties.
But they widened that area instead of like reducing it. Is that correct, Randy?
I don't think they changed it. Really, a lot of the changes have been more technical along with definitions and things like that, rather than the areas covered are established through the maps that the council has already approved. So those are called the firm maps. So that's what council did. They kind of really got the ball started on a lot of this. And council approves those maps. We send those in then to the state and the feds to review. And Randy, anything else that we need to?
No, basically, when the maps were basically approved by council, there were very minimal changes. The biggest one probably down in the confluence area towards Bear Creek and the South Platte Rivers. But other than that, there were really no changes to our firm, so.
I don't think it affected like any
Residents.
residential, commercial properties
No,
really.
there were no significant changes at all.
Thank you.
Thanks. Any other questions? Right. Okay, anything else about this evening, or do you want to start your manager's report?
The only other, the only other item that we have for your action this evening is the contract for the Carol's Corner Pub property and the demo on that. Which I informed the mayor earlier, I'm sad we'll no longer be pub owners after this. 'Cause lots of people own open space, but we had a pub for a little while, but okay. Anyway, Andrew, is there anything that council needs to know on that one that you wanted to know before we vote on that? It's pretty straightforward, a contract for the demo. We had a lot of we actually received, how many bids did we receive? It was like 12 bids on this process, and staff reviewed that, found that the low bid on that was responsive and felt that we could go ahead and move forward with them on that. And then timeframe is, once it's approved, they'll start
Has to be done
in
by
how long,
July
Andrew?
1st,
I'm sorry.
right? Done by July 1st.
Done by July 1st. There we go.
Yeah.
Okay. There we go. So that's that, pretty straightforward on that one. For my manager's report, I don't have a whole lot. Last week I was out for most of the week at the Colorado City and County Managers Association Annual Conference. Always good to see managers from around the state and catch up on what's going on with a lot of the municipalities. Attended a number of good sessions. Had a great session by the state demographer. She is just fantastic. If you ever get a chance, Elizabeth Gardner, right?
Yeah.
Okay. She's fantastic. If you ever get a chance to see a session or a presentation by her, by all means, I encourage you to do that. She's very, very sharp and entertaining. She makes demographics entertaining. And she really does. She's just a great job. Then I went to some sessions about organizational culture, ethics, economic outlook, a few other ones. So it was a good session, and I appreciate council supporting me and going to that conference every year. Always a good one, and always have some good takeaways from that conference. Also last week I attended a briefing on the Navigation Center and a status update on the construction of the Navigation Center with the Bridge House folks. Construction has begun. I started on the 8th of this month. They're working on demo and utilities for the existing building. They did run into an asbestos patch. It's gonna not, so it's not a big patch of that they have to deal with, so it's not gonna slow them down any. They kind of build a little bit of that into the schedule just in case. So that's being addressed, and we're still on track for substantial completion in November of this year. Last item I have, Mayor, is that May 27th would be our second May meeting. It also happens to be Memorial Day, and we'll be closed here. Had a brief discussion with the mayor prior to this meeting. We don't have anything for the agenda that's pressing or pending on that particular date. So at this point, we're recommending that we go ahead and cancel that meeting rather than postpone and reschedule. We can always do that if something pops up, but I think at this point, we're just recommending that we would cancel that meeting, give everybody the night off on that one. That's all I've got for right now, Mayor. Be happy to answer any questions.
Right. I don't remember, do we need to take any action on that, or is it all on Jenna to notify people that there's no meeting? It's all
Yeah.
on you. Okay,
Yeah, you don't have to take any formal action
Okay.
to do that.
great. Then we'll adjourn the work session at 6:58. And we'll have just a couple minutes before we start the regular meeting.
Alive and kicking? Yeah, right. I didn't think it. That's like. Right when I saw the video. I still didn't get time to do it. I'm just gonna.
Evening, everybody. Welcome. Can we start with another introduction from our interpreter?
Yes, thank you, everybody. Hi, my name is Andrea. I'm here with the Community Language Cooperative. We're going to be practicing language justice today. We're going to have simultaneous interpretation in English and in Spanish for those who are participating in Zoom. And once we turn on the interpretation, you're going to see a globe that is going to come up at the bottom of your screen where you're going to be able to select your preferred language. Please remember to speak at a conversational pace whenever it's your turn to speak. Hola a todos, mi nombre es Andrea, estoy aquí con la Community Language Cooperative. Hoy vamos a practicar la justicia del lenguaje y vamos a tener interpretación simultánea en inglés y en español. En algunos segundos, cuando aprendamos de interpretación, ustedes van a ver un globo que va a aparecer en la parte inferior de su pantalla, donde van a poder seleccionar su idioma. Por favor, recuerden hablar a un paso conversacional cuando sea su turno de hablar. And thank you, we can begin interpretation now.
Thank you. I'll call this regular meeting of the Sheridan City Council to order for April 22nd, 2024, and the time is 7:04 p.m. We all please sign in. Thank you. Looks like we have everyone present. Can we please rise for the invocation followed by the Pledge of Allegiance?
God of peace, we pray for unity in our meeting today. We have come together as a group united in passion and purpose. Come and help us maintain unity as we discuss certain matters. We pray for open hearts and minds that will promote and accept better ideas. If there be anyone who is remiss and failing, we ask for humility to accept and learn from necessary correction. Dear God, we seek your honor in everything we do and say. So we lift up this meeting to you. Be in our midst. Bind our hearts and minds by your Spirit. Amen.
Amen.
Pledge allegiance
Pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. We have any updates to the agenda?
No changes to the agenda, Madam Mayor.
Thank you. Our first item tonight is receive and file the financial reports. I have a motion from Councilmember Stang and seconded by Councilmember Kelly. Any discussion or questions on the financial reports? Okay, please cast your votes. That motion is approved unanimously. Next, we have staff reports. City Clerk.
Yes, Mayor, just a couple updates. So you saw in front of you, there's a new open meeting little card. We have switched servers, and so if you are remoting in, you'll have to change the remote connection so that new number is on your card. If you have questions or trouble, let me know on that. And then also in front of you have an invitation to the county's state update, or sorry, yeah, the state of the county update. That's gonna be on June 6th. Let me know if you're interested in attending, and if we get enough people, we can just get a full table for the city. And then last item I have is that I have now added a QR code to our packet area that you can scan the QR code and have the packets digitally. So for anyone in the audience, they can scan it and see the packet on their phone. So, and that's all I have this evening.
Thank you. Constant innovation from the clerk.
Trying.
Love it. All right, Attorney, anything?
Thank you, Mayor. Just a quick update for council this evening. I just wanted to let you know that my office has been supporting staff in its code enforcement efforts, and staff has been bringing in the city prosecutor's office into more of those matters to kind of get ahead of just a number of code enforcement issues that your staff has been dealing with. And so I just wanted to let you know that my office is kind of in a supportive role as your staff starts to work more with our city prosecutor's office, who's been a really wonderful resource to all of us, actually. And so I just wanted to let you know that's happening in the background, and you have your staff is really just on top of these issues and doing a great job. So I just wanted to provide that update.
Thank you. City Manager, anything else?
Nothing else to add, but happy to answer questions. Thank you, Mayor.
Thank you. Chief?
Just a quick update for all of you, and especially for Councilman Kelly. Our drone program was just about to get underway finally. We purchased the drone last year. We had 5 sergeants go to a drone school thanks to Cherry Hills. They were hosting a school, so we had them get in there. They still need to go to the FHA and get their licensing, so they're studying for that test. But it's going to be a wonderful tool. I thought we were pretty up on most things, but a lot of our agencies next to us have been up with their drone program for well over a year. So we're a little behind the curve, but we're happy to finally get it here. It's going to be very helpful if we ever have instances where there's a major incident. Of course, we can put the drone overhead and have eyes on. Also, if there's maybe a lost person or a child, especially along the riverbanks, it'd be a great way to search quickly. Also some of the larger yards that we have here. It'll actually multiply our safety for our officers by getting them closer without being able to put themselves in harm's way all the time. But I just want you all to know, in case you start seeing a drone up, very well could be ours. You can always call and ask me if we had it up or if anything's going on. But our drone's a pretty good sized drone. It's a nice drone. It's with the wings expanded, it's about this big. So it's not one of the real small ones that you would see. Although we might get one or two of those little ones for like searching inside Costco or some of those bigger stores
Oh, wow.
where we can get it in and it's a little more versatile or easy to get around things. We might get those, but right now we just have the one big one, so that would be the one if you see it. You can always ask me or we'll find out if it's up. So
Cool.
any questions?
Well, when you guys do the first launch, I want to be there.
Okay, I know you
I
do.
want to see it.
It is pretty cool. Speaking of innovation, some out of the
Absolutely.
PD too.
Okay,
Awesome.
thank you.
Anybody have any questions for staff before we move on? No? Okay, we'll go on to the minutes of the regular city council meeting of April 8th, 2024. Have a motion from Councilmember Kelly, a second from Councilmember Moreno. Any questions on the minutes? Corrections? No. Okay, please cast your votes. That motion is approved unanimously. Next tonight, we have the consent agenda, authorized disbursements that have been or will be made from April 1st, 2024 to April 15th, 2024 in the amount of $404,398.70 per the attached and reference transfer of funds. I have a motion from Councilmember Moreno and a second from Councilmember Stang. Any questions on the consent agenda? Please cast your votes. Motion is approved unanimously. We have items for individual consideration, emergency ordinances, and we will invite comments from the public prior to voting on the emergency ordinance. Ordinance number 3 of 2024, an ordinance of the City Council of the City of Sheridan, Colorado, repealing, reenacting in its entirety and retitling Chapter 56, Article 17 Floodplain Overlay District of the Sheridan Municipal Code and declaring an emergency therefore. I have a motion from Councilmember Whitaker, second from Councilmember Camacho.
I think my screen's a little delayed or something like that. It's still showing the finance. Yeah, let's see.
Yeah. You want
Yeah, I'll log out real quick.
Everybody
yeah.
else is okay. We'll keep going. Okay, we'll take this opportunity for public comment if there's anyone who wants to speak on this ordinance number 3. Don't see anyone here.
Mayor, I do have people that are got hands raised online for this, but I don't, since we're not taking online public comment anymore.
Yeah, we're not allowing that. So. Still not working.
No. We'll see if it changes.
Jenna, my screen is also showing authorized disbursement
Yeah.
or disbursements that have been made.
On your screens now, when I click that one or no?
Yeah, it goes to the voting.
Okay, so yeah, that's for the consent agenda though.
Right.
I can go through a roll call vote. if you
Yeah,
prefer.
let's do that.
Okay.
Thank you.
Councilmember Moreno? Stang? Yes. Kelly?
Yes.
Mayor Butterfler?
Yes.
Councilmember Whitaker?
Yes.
Councilmember Lopez? And Councilmember Camacho?
Yes.
Okay, that passes with a 2/3 vote of the full membership.
Okay. All right, let's see if things move along here.
Individual. Yeah.
Doesn't look good over here. Okay, well, we'll move on to resolutions. We have resolution 13 of 2024. A resolution of the City Council of the City of Sheridan, Colorado, approving an agreement between American Abatement, Inc. and the City of Sheridan for the 3600 South Federal Boulevard asbestos abatement and demolition project. Did anybody make a motion or are you not there?
Yeah.
I can see that I have a motion in a second, but
Let's just get a verbal motion in a second if we could. Anyone want to make that motion? And now you've forgotten how to make verbal motions. I see how it is.
I'll move that we move to approve the
Resolution 13.
resolution.
Yeah.
Yeah, 13/2024 as presented.
Okay. Do I have a second?
I'll second.
Great. I have a motion from Councilmember Moreno and a second from Councilmember Kelly. Any discussion on resolution 13? Nope. Okay, then let's have a vote, please.
Okay, I'll do a roll call vote.
Yes.
Councilmember Stang,
Yes.
Kelly,
Yes.
Mayor Butterfleur,
Yes.
Councilmember Whitaker,
Yes.
Councilmember Lopez,
Yes.
and Camacho.
Yes.
Oh, sorry, and Councilmember Moreno. Sorry, you're on my other side now. Yes. All right, that passes by a majority vote.
Thank you.
You're welcome.
Okay, next tonight we have Mayor's Choice. It looked like Andrew said we have some Roots in Sheridan gear after the meeting, if you all want to take a look, see what we have. I'm going to be doing some letter writing and some testimony for the Senate. Some of those bills on housing, the ADUs and parking have been passed through the House and moved on to the Senate. So they're having testimony tomorrow on the 1313, which is the housing bill and the ADU bill, and then Thursday on the parking bill. So I'm going to put together a letter to Senator Bridges to send out tonight, and then also I'm planning to testify tomorrow. I can't go Thursday. If anybody here wants to volunteer, I'd be glad to send you talking points. But if you don't, I don't blame you, because you have to get on there at like 2 o'clock and you might not get to testify till like 8 or 9, depending on how many people are in line. But if you want to let me know if anyone's available on Thursday from 2 to an undefined end time. You can do other things while you're waiting. You know, you can multitask, but you've got to keep an ear open for when they call you.
We'll talk about it after.
Okay, okay. Last thing I wanted to bring up is that Sheridan Celebrates is raising money for Commune this year for grocery delivery to people who are homebound. And the videos for that fundraising competition are now posted. And I believe, did Amy, I think Amy sent a post with that, didn't she? I think so. You should have some sort of, Sheridan News alert about putting in your votes on our fundraiser. Basically, you vote with your dollars. So, every dollar is basically a vote for whichever video you like. And of course, the point is really the fundraising, though whoever gets selected will get to perform or present or whatever at Sheridan Celebrates as well as their reward. So, and it's just a fun thing. I have a video out there. Doesn't mean you have to vote for mine, but it is the best one. So.
Yeah,
So,
do yourself a favor and go check out the mayor's video. It's
Yeah.
awesome.
All right, and that's all I have. Anybody on council have anything?
I do.
Go ahead.
I'm withdrawing my being on Sheridan Celebrate. So and for personal reasons. Okay.
Okay. So yeah, anybody else, let me know if you're interested in joining as a voting member of Sheridan Celebrates Committee. You interested? Awesome. Okay, well, we can, do I do that in my mayor's choice, or is that, I forget how we do that. Yes?
Yeah, that would be fine. That's where you've done it in the
Can I
past. And
just, can I just back up for a second?
Yes,
then?
you may.
All right, I'd like to nominate Anthony Lopez for the Sheridan Celebrates Committee.
A second.
Right. All in favor?
Aye.
Opposed? None. Great. Thank you so much, Councilmember Lopez. I appreciate it. We'll get you the info. If Jean hasn't already sent you everything, I know how she is. So. All right. Anybody else have anything for tonight?
I do.
Go ahead.
So the Roots in Sheridan program, I thought was pretty awesome. This is a picture of them installing the tree that I ordered in the backyard. It was great. I was at work, I was able to not have to plant it myself, but I just think the whole program is just awesome. And that, adding, what was it, 1,000 trees?
100.
100 trees. Well, let's hope someday it'll be 1,000, but it's just it's a neat thing, I think, that benefits the community and the tree canopy, and I just wanted to thank the staff. I wish Ari was here too, but I just think it was a great program, went very smoothly, and I really appreciate it.
Awesome.
Oh, that's the tree dropped in front of my house. So it sat there by itself in the snow for a little while before they came and planted it, but really efficient process. I only got one. Mm-hmm.
Wow, good. Wow, the ante's been upped. So I have to see how many trees I can cram in my yard. All right, well, that's great. I wonder if it's always going to snow on our tree planting weekend. I think we had it last year. Yeah.
It was easy to plant.
It did. Yeah, the first day they were doing planting.
Yeah.
Okay. Anybody else have anything for tonight? No? Okay. Then we have time for public comment. If there's anyone present here who would like to speak to council, you can have 2 minutes to speak to us. Do we have anybody on the list before I just invite people?
I believe Dallas Hall is the only
Oh,
one
okay.
on the list, but yes.
Please, Dallas Hall.
Dallas Hall, 4185 South Dale Court. It's good to speak to you guys. Great to be here with you, staff, everybody. Thank you for this opportunity. Roots in Sheridan, that was a great program, and I've always liked it. Very good. And I've noticed all the short little trees all over the place in the city. Along with tree planting comes planning. I think we failed. Chase Park, it was planned. That park was planned with a basketball court, an open area for kids to play, such as soccer or football. They play volleyball there, do a lot. There's 3 trees planted right down the center of it. Puts an end to that. I was up there today and there's a young kid there with a soccer ball analyzing an open spot, and it's gone. You know, if those trees would have went 15
Yeah.
feet to the west, it would have been perfect. It would have given shade to that field. It would have been perfect. But anyway,
Those are just planted this weekend then, right?
what's that?
They were just planted this weekend?
Yes.
Okay, well. Seems like it's not too late to change.
I hope it is. I really would like to see those.
Yeah.
Let's go dig them
move
up.
over to the side, and it would be good.
Yeah.
It's also, I don't know, I think it's the care that they may have there is, it's iffy, but anyway, great program, but a little more planning on where we're gonna put them. Not every open spot needs a
Yeah.
tree. So, thank you.
Thank you.
Thank you very
Appreciate
much.
that. Yeah, that sounds like that needs to get changed. I was on the team last year and I know it's sometimes a little by the seat of your pants out there doing the planting, the planting, you know, like where is it supposed to go? So some people may not have quite understood. All right, anybody else? We didn't have anybody else on our list for public comment, right? Is there anybody else in the room who would like to speak to council tonight? No? Okay, then we'll adjourn this meeting at 7:23 PM and we have our Sheridan Redevelopment Agency meeting. So we'll move right into that. So I'll call to order the Sheridan Redevelopment Agency meeting for April 22nd, 2024. The time is 7:24 PM. Is everybody else able to?
Okay, I just loaded the meeting
Okay.
software, so you should be able to get back on.
Sorry, I didn't want to rush it, but.
Yeah, give me 2 seconds. Wait for that to connect.
Kicked you out too. Yeah.
Yeah. Well, should we just go old school here?
Yep.
or-
Like,
Okay.
Yep.
All right. We still have all board members present. So we'll move on to the approval of minutes. Can I get a motion on the minutes?
Make a motion.
I'll second.
I have a motion from Councilmember Kelly and a second by Councilmember Whitaker. Any discussion or questions on the minutes? Can we get a vote on that, please?
Member Moreno,
Yes.
Stang,
Yes.
Kelly,
Yes.
Chairman Butterfly,
Yes.
Member Whitaker,
Yes.
Lopez,
Yes.
Camacho. That passes unanimously.
Thank you. Next, we have the financial reports. Receive and file the financial reports.
Second.
A motion made by Board Member Camacho, second by Board Member Stang. Any questions or discussion on the financial reports? Okay, can we get a vote, please?
Member Stang,
Yes.
Kelly,
Yes.
Chairman Butterfly,
Yes.
Member Whitaker,
Yes.
Lopez,
Yes.
Camacho, Moreno. That passes unanimously.
Thank you. Now we have the approval of disbursements, authorized disbursements for April 2024 in the amount of $153,496.42 that have been or will be made for expenses referenced below. Legal expenses, none. Other professional services, $9,439.96. City support services, $143,301. Other expenses, $755.46.
Move to authorize the disbursements as presented.
Second.
A motion from Board Member Moreno and a second from Board Member Stang. Any questions on the disbursements? No? Can we get a
Mm.
vote, please?
Member Kelly,
Yes.
Chairman Butterfly,
Yes.
Member Whitaker,
Yes.
Lopez,
Yes.
Camacho, Moreno,
Yes.
Stang.
Yes.
That passes unanimously.
Thank you. We have new business, the Pinnacle Report for February of 2024.
Good evening, everyone. Can you hear me
Hi.
this time?
Yes.
All right. So the Pinnacle Report tonight, the new retailers, the Dollar Tree and the Teriyaki Madness, they're still moving along. What we're hoping is the Dollar Tree will open this fall sometime. Haven't heard an opening date on Teriyaki Madness quite yet. Our pledged revenues continue to be higher, so always a good sign. So year to date, it's 6.76 higher, which that graph just keeps going up. So in that beautiful green color that I've got in there. Continuing compliance, we didn't have anything this month. As far as the audit is going, both for the city and the SRA, the auditors have came back with all of their audit questions and their research as far as providing things. So the SRA, Wendy provided all of that information and has them continuing to go forth. So far, the only thing is that we will need to amend the budget. I know we've talked about this multiple times, but we're going to bring that back to you at our next SRA meeting, that will be amending the budget. That was for the debt service because we had higher revenue. So we had more B bond payments. So a good problem to have. And then the city audit, again, just asking lots of questions as usual, but so far, no problems, just getting them everything. And then we plan to present those at the June 24th meeting. So happy to answer any questions for you.
Any questions for Teresa? No? Okay, thank you.
Perfect. Thank you, guys.
All right, we'll adjourn this meeting at 7:29 p.m. Thank you, everybody, for being here.